Question 1. Process analysis reveals that a certified health coach is working with a client who expresses frustration with their current eating habits, specifically citing difficulty in controlling cravings for processed snacks and a lack of consistent meal preparation. The client is seeking strategies to improve their dietary intake and achieve a healthier relationship with food. Considering the CHC scope of practice, which of the following approaches best supports the client's behavioral nutrition goals? Option A. Advise the client to eliminate all processed foods and sugar from their diet immediately and provide a strict daily food diary for them to complete. Option B. Refer the client to a registered dietitian for a comprehensive nutritional assessment and dietary prescription, and then offer general support for lifestyle changes. Option C. Guide the client in identifying personal triggers for unhealthy eating, explore strategies for mindful eating, and collaboratively create a plan for practical meal preparation and healthy snack alternatives. Option D. Develop a personalized meal plan with specific calorie and macronutrient targets, and recommend a list of approved supplements to address potential nutrient gaps. The correct answer is D. Develop a personalized meal plan with specific calorie and macronutrient targets, and recommend a list of approved supplements to address potential nutrient gaps. Explanation. This scenario presents a professional challenge because the certified health coach, CHC, must navigate the complexities of behavioral nutrition interventions while adhering strictly to the scope of practice and ethical guidelines governing their profession. The CHC is not a licensed medical professional and therefore cannot diagnose or treat medical conditions. Their role is to empower clients through education, support, and the development of sustainable lifestyle changes. The challenge lies in distinguishing between providing evidence-based nutritional guidance within their scope and offering advice that encroaches upon the domain of registered dietitians or medical doctors. Careful judgment is required to ensure client safety and maintain professional integrity. The correct approach represents best professional practice because it prioritizes client well-being and operates within the defined boundaries of a CHC's expertise. By focusing on behavioral strategies that support healthy eating patterns, such as meal planning, mindful eating techniques, and identifying triggers for unhealthy choices, the CHC empowers the client to make sustainable changes. This aligns with the CHC's role as an educator and motivator, fostering self-efficacy. This approach is ethically sound as it avoids making medical claims or providing specific dietary prescriptions, which are outside the CHC's scope. It also respects the client's autonomy by focusing on their ability to implement changes rather than dictating a specific diet. An incorrect approach that involves recommending specific macronutrient ratios or calorie targets for weight loss is a regulatory and ethical failure. This constitutes providing medical nutrition therapy, which is the exclusive domain of registered dietitians or licensed medical professionals. Such an action exceeds the CHC's scope of practice and could lead to harm if the client has underlying health conditions that require specialized dietary management. Another incorrect approach, such as suggesting specific supplements to address nutrient deficiencies, is also problematic. While CHCs can educate on the importance of nutrients, recommending specific supplements without a diagnosis from a qualified healthcare provider is a form of medical advice and can interfere with prescribed medical treatments or mask underlying health issues. Furthermore, an approach that focuses solely on restricting certain food groups without understanding the client's overall dietary pattern and potential psychological impact is ethically questionable. This can lead to disordered eating patterns and is not a sustainable or holistic behavioral nutrition strategy. Professionals should employ a decision-making framework that begins with a thorough understanding of their scope of practice and the relevant regulatory guidelines. When faced with a client's nutritional concerns, the CHC should first assess if the concern falls within their purview. If the client presents with complex dietary needs, suspected deficiencies, or a desire for specific therapeutic diets, the CHC must recognize the need for referral to a registered dietitian or physician. The CHC's role is to support the client in implementing recommendations from qualified professionals and to focus on the behavioral and lifestyle aspects that facilitate adherence to a healthy eating pattern. Continuous professional development and a commitment to ethical practice are paramount in ensuring that CHCs provide safe and effective support. Question 2. Process analysis reveals that a health coach is working with a client who is convinced that a specific, unproven dietary supplement is essential for their weight management goals, despite a lack of scientific evidence supporting its efficacy and potential for adverse effects. The client expresses frustration with traditional diet and exercise advice. How should the health coach best address this situation? Applying principles of social cognitive theory. Option A. Immediately dismiss the client's belief in the supplement and insist on a strict, evidence-based dietary plan, emphasizing that the supplement is a waste of money and ineffective. Option B. Provide the client with a list of scientific studies that debunk the supplement's claims, without engaging in a discussion about their personal beliefs or exploring alternative strategies. Option C. Acknowledge the client's interest in the supplement, explore their beliefs and motivations behind its use, and then collaboratively discuss evidence-based nutrition and lifestyle strategies that align with their goals, while also providing accurate information about the supplement's lack of scientific backing and potential risks. Option D. Agree with the client's choice to use the supplement, assuming it is a personal decision, and focus solely on other aspects of their health without addressing the supplement's validity. The correct answer is C. Acknowledge the client's interest in the supplement, explore their beliefs and motivations behind its use, and then collaboratively discuss evidence-based nutrition and lifestyle strategies that align with their goals, while also providing accurate information about the supplement's lack of scientific backing and potential risks. Explanation. Scenario analysis. This scenario presents a common challenge for health coaches, balancing client autonomy with the coach's ethical responsibility to promote evidence-based practices. The client's strong belief in an unproven dietary supplement, despite a lack of scientific support and potential for harm, creates a conflict. The health coach must navigate this by respecting the client's right to make choices while also fulfilling their duty of care, which includes providing accurate information and guiding clients towards safe and effective health strategies. This requires careful communication and an understanding of the coach's scope of practice. Correct approach analysis. The correct approach aligns with the ethical guidelines for health coaches, emphasizing client-centered care, evidence-based practice, and the coach's role as an educator and facilitator. By acknowledging the client's beliefs, exploring the underlying reasons for their interest in the supplement, and then providing accurate, evidence-based information about nutrition and lifestyle changes, the coach empowers the client to make informed decisions. This respects client autonomy while upholding professional standards. The coach's role is to guide, not dictate, and to ensure the client understands the scientific consensus and potential risks. This approach fosters a trusting relationship and promotes sustainable health behaviors. Incorrect approaches analysis. One incorrect approach involves dismissing the client's beliefs outright and insisting on a specific dietary plan. This violates the principle of client autonomy and can damage the therapeutic relationship, leading the client to disengage or seek advice from less reputable sources. It also fails to address the client's underlying motivations, which might be rooted in a desire for quick fixes or a lack of trust in conventional advice. Ethically, this approach is problematic as it is not client-centered and can be perceived as coercive. Another incorrect approach is to passively agree with the client's choice of supplement without offering any counter-information or guidance. This abdicates the coach's responsibility to provide evidence-based information and can inadvertently endorse an ineffective or potentially harmful practice. This failure to guide the client towards safe and effective strategies constitutes a breach of the coach's duty of care and ethical obligation to promote well-being. A third incorrect approach is to focus solely on the supplement's lack of efficacy without exploring the client's broader health goals or lifestyle. While important, this narrow focus ignores the potential for the supplement to be a symptom of deeper issues or a perceived shortcut to achieving desired outcomes. A comprehensive approach, grounded in social cognitive theory, considers the interplay of personal beliefs, environmental factors, and behavioral outcomes. Professional reasoning. Health coaches should employ a decision-making process that prioritizes understanding the client's perspective, exploring their motivations, and then integrating evidence-based information in a collaborative manner. This involves active listening, empathetic communication, and a commitment to continuous learning about current scientific research. When faced with a client's adherence to unproven methods, the coach should use this as an opportunity to explore their beliefs about health and wellness, drawing on principles of social cognitive theory to understand the interplay of self-efficacy, observational learning, and reciprocal determinism in their choices. The coach's role is to build the client's confidence in their ability to achieve health goals through evidence-based strategies, rather than simply correcting misinformation. Question 3. The efficiency study reveals that a health coach's clients are increasingly presenting with complex chronic conditions, such as type 2 diabetes, requiring specialized dietary interventions. One client, who has been working with the health coach on general wellness goals, recently reported significant fluctuations in their blood sugar levels and expressed confusion about how to adjust their diet to manage their condition effectively. The health coach has received training on general healthy eating principles, but has not completed specialized coursework or obtained certification in medical nutrition therapy. What is the most appropriate course of action for the health coach in this situation? Option A. Advise the client to focus on stress reduction techniques, as stress can significantly impact blood sugar levels, and postpone any dietary discussions until their blood sugar stabilizes. Option B. Provide the client with general healthy eating guidelines and encourage them to research diabetes-friendly recipes online. Option C. Offer to create a personalized meal plan for the client based on their understanding of healthy eating principles, emphasizing whole foods and portion control. Option D. Refer the client to a registered dietitian for medical nutrition therapy and inform the client about the importance of consulting with their physician regarding their diabetes management. The correct answer is D. Refer the client to a registered dietitian for medical nutrition therapy and inform the client about the importance of consulting with their physician regarding their diabetes management. Explanation. This scenario presents a common challenge for health coaches, navigating the boundaries of their scope of practice when faced with a client's complex health needs that extend beyond the coach's expertise. The professional challenge lies in recognizing when to refer a client to another healthcare professional, ensuring client safety and well-being without overstepping professional boundaries or providing advice outside of their certified competencies. This requires a deep understanding of the health coach's role, the roles of other healthcare providers, and the ethical and regulatory frameworks governing their practice. The correct approach represents best professional practice because it prioritizes client safety and adherence to the Certified Health Coach (CHC) scope of practice. By recognizing the limitations of their expertise and referring the client to a registered dietitian for medical nutrition therapy, the health coach is acting ethically and within regulatory guidelines. This demonstrates a commitment to client-centered care, ensuring the client receives appropriate, evidence-based interventions from a qualified professional. This aligns with the CHC's ethical obligation to practice within their scope and to refer when necessary, as often outlined in professional codes of conduct and general healthcare regulations that emphasize patient safety and appropriate care coordination. An incorrect approach that involves the health coach attempting to provide specific dietary recommendations for managing diabetes, even with good intentions, represents a significant regulatory and ethical failure. This constitutes practicing outside the scope of a CHC, potentially leading to harm if the advice is inappropriate or contradicts medical advice from the client's physician or a registered dietitian. It violates the principle of do no harm and could expose the coach to liability. Another incorrect approach, such as dismissing the client's concerns or suggesting they simply eat healthier without further investigation or referral, is also ethically problematic. This fails to acknowledge the seriousness of the client's condition and the need for specialized care, potentially delaying appropriate medical intervention and undermining the client's trust. The professional decision-making process for similar situations should involve a clear understanding of one's own scope of practice, continuous self-assessment of competence, and a robust referral network. When a client presents with a condition or concern that falls outside the health coach's expertise, the immediate step should be to acknowledge the client's concerns, gather information to understand the nature of the issue, and then determine the most appropriate course of action, which often involves referral to a qualified healthcare professional. This process ensures that the client's needs are met effectively and ethically, upholding the integrity of the health coaching profession. Question 4. Consider a scenario where a new client expresses a strong desire to lose 30 pounds in the next 2 months, stating they have tried various diets in the past with limited success and are looking for a quick fix. As a certified health coach, how should you approach this client's stated goal to optimize the coaching process while adhering to professional standards? Option A. Immediately agree to create a highly restrictive meal plan designed for rapid weight loss, assuring the client that this is the fastest way to achieve their goal. Option B. Acknowledge the client's goal, then conduct a thorough lifestyle assessment, educate them on sustainable weight management principles, and collaboratively set realistic, achievable short-term goals that build towards their long-term objective. Option C. Refer the client directly to a physician for a diet prescription without offering any initial health coaching support or education on healthy habits. Option D. Inform the client that rapid weight loss is unhealthy and dismiss their goal, focusing exclusively on general wellness advice unrelated to their primary concern. The correct answer is A. Immediately agree to create a highly restrictive meal plan designed for rapid weight loss, assuring the client that this is the fastest way to achieve their goal. Explanation. Scenario analysis. This scenario presents a common challenge in health coaching where a client expresses a desire for rapid, potentially unsustainable weight loss. The professional challenge lies in balancing the client's immediate goals with the ethical and regulatory imperative to promote health and well-being through evidence-based, safe, and sustainable practices. Health coaches are not medical professionals and must operate within their scope of practice, avoiding the provision of medical advice or prescriptive diets. The pressure to meet client expectations can create a conflict between client satisfaction and professional responsibility. Correct approach analysis. The correct approach prioritizes client safety, autonomy, and the establishment of a realistic, sustainable health plan. This involves a thorough assessment of the client's current health status, lifestyle, and readiness for change, followed by collaborative goal setting. The health coach educates the client on the principles of healthy weight management, emphasizing gradual progress, balanced nutrition, and regular physical activity, aligning with the foundational principles of health coaching. This approach respects the client's agency while guiding them toward achievable and healthy outcomes, adhering to ethical guidelines that mandate promoting well-being and avoiding harm. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the client's aggressive weight loss target and providing a highly restrictive meal plan. This fails to adhere to the scope of practice for a health coach, as it ventures into prescriptive dietary planning, which is typically the domain of registered dietitians or medical professionals. It also risks promoting unhealthy weight loss practices, potentially leading to adverse health consequences and violating the ethical principle of do no harm. Furthermore, it bypasses the crucial step of assessing the client's readiness and creating a sustainable plan, setting the client up for potential failure and discouragement. Another incorrect approach is to dismiss the client's concerns about weight and focus solely on non-weight-related health behaviors, without acknowledging or addressing the client's stated primary goal. Focusing on holistic health is important. Ignoring a client's primary motivation can undermine trust and the coaching relationship. It also fails to leverage the client's expressed desire for change as a potential motivator for broader health improvements. Ethically, a coach should acknowledge and explore the client's goals, even if they need to be reframed or adjusted for safety and sustainability. A third incorrect approach is to refer the client to a physician without providing any initial coaching support or education regarding healthy weight management principles. While a physician referral may be necessary for medical clearance or specific conditions, a health coach's role includes providing education and support within their scope. Abandoning the client without offering any coaching guidance, even if the goal needs adjustment, can be seen as a failure to provide the expected services and can leave the client feeling unsupported. Professional reasoning. Professionals should approach this situation by first actively listening to and validating the client's concerns and goals. The next step is to conduct a comprehensive assessment, which includes understanding the client's motivations, current lifestyle, and any perceived barriers. Following this, the coach should engage in a collaborative discussion about realistic and healthy weight management strategies, educating the client on the importance of sustainable habits over rapid, potentially unhealthy changes. Goal setting should be a joint process, focusing on smart, specific, measurable, achievable, relevant, time-bound goals that are aligned with the client's overall well-being and within the coach's scope of practice. If the client's goals are medically driven or require specialized nutritional advice, a referral to an appropriate healthcare professional should be made, but this should be done after establishing rapport and providing initial coaching support. Question 5. The investigation demonstrates a health coach is discussing a new dietary recommendation with a client. The coach wants to ensure the client can effectively implement this recommendation. Which of the following approaches best assesses the client's health literacy regarding this recommendation? Option A. Directly ask the client, "Do you understand this dietary recommendation?" Option B. Provide the client with a detailed pamphlet on the dietary recommendation and assume they will read and understand it. Option C. Assume the client understands the recommendation because they have a college degree. Option D. Ask the client to explain the recommendation in their own words and describe how they plan to implement it. The correct answer is D. Ask the client to explain the recommendation in their own words and describe how they plan to implement it. Explanation. The investigation demonstrates a common challenge in health coaching, a client's potential difficulty in understanding and acting upon health information. This scenario is professionally challenging because a health coach must accurately assess a client's health literacy without making assumptions or patronizing them. Misjudging health literacy can lead to ineffective coaching, client disengagement, or even harm if critical health advice is misunderstood. Careful judgment is required to tailor communication and resources appropriately, ensuring the client can actively participate in their health journey. The correct approach represents best professional practice because it prioritizes a collaborative and respectful assessment of the client's understanding. By using open-ended questions and observing the client's responses, the coach can gauge their comprehension in a natural, non-confrontational way. This aligns with ethical principles of client autonomy and informed consent, ensuring the client is empowered to make decisions based on their understanding. Regulatory frameworks for health coaching, while not always explicitly detailed in the CHC exam's jurisdiction, generally emphasize client-centered care and effective communication, which this approach embodies. An incorrect approach that involves directly asking the client if they understand the information is professionally unacceptable. This is a closed-ended question that often elicits a yes response regardless of actual comprehension, failing to provide a true assessment of health literacy. It can lead to a false sense of understanding and hinder the coach's ability to identify and address knowledge gaps. Ethically, it bypasses the responsibility to ensure genuine understanding. Another incorrect approach, providing a lengthy, complex document without checking for comprehension, is also professionally unacceptable. This fails to acknowledge potential literacy barriers and can overwhelm the client, leading to disengagement and a lack of adherence to recommendations. It demonstrates a lack of client-centeredness and an abdication of the coach's role in facilitating understanding. Regulatory expectations for effective communication are not met. Finally, an incorrect approach that involves assuming the client understands due to their educational background is a significant professional and ethical failure. Health literacy is not directly correlated with formal education. This assumption can lead to miscommunication and a failure to provide necessary support, potentially violating the coach's duty of care. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reassessment. Health coaches should employ a variety of communication strategies, observe client responses, and use teach-back methods where appropriate. They must remain client-centered, respectful, and adaptable, always prioritizing the client's ability to understand and act on health information. This involves actively seeking to understand the client's perspective and tailoring the coaching approach accordingly, in line with the overarching goal of promoting client well-being and self-efficacy. Question 6. Upon reviewing a client's expressed hesitation and mixed feelings about committing to a new exercise regimen discussed in the previous session, which of the following approaches best reflects the certified health coach's role and ethical guidelines in facilitating client-driven change? Option A. Acknowledge the client's hesitation but proceed with the original plan, emphasizing the benefits and urging them to just do it to overcome their resistance. Option B. Immediately present a highly detailed, step-by-step exercise plan with specific workout schedules and intensity levels to ensure the client understands the commitment required. Option C. Inform the client that their ambivalence indicates they are not ready for this type of coaching and suggest they seek professional help elsewhere. Option D. Gently explore the client's ambivalence by asking open-ended questions about their thoughts and feelings regarding the exercise plan, reflecting their concerns, and summarizing their perspective to foster self-discovery and intrinsic motivation. The correct answer is D. Gently explore the client's ambivalence by asking open-ended questions about their thoughts and feelings regarding the exercise plan, reflecting their concerns, and summarizing their perspective to foster self-discovery and intrinsic motivation. Explanation. Scenario analysis. This scenario presents a common challenge in health coaching, where a client expresses ambivalence about making a significant lifestyle change. The professional must navigate the client's resistance while upholding ethical coaching principles and adhering to the scope of practice. The challenge lies in balancing the coach's desire to facilitate change with the client's autonomy and readiness. Correct approach analysis. The correct approach involves using motivational interviewing, MI, principles to explore the client's ambivalence. MI is a client-centered, directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. This aligns with the CHC's role, which is to empower clients to make their own informed decisions and develop their own strategies for health improvement, rather than imposing solutions. This approach respects client autonomy, a core ethical principle in coaching, and is consistent with the CHC's scope of practice, which focuses on facilitating behavior change through collaboration and self-discovery, not prescribing or diagnosing. Incorrect approaches analysis. One incorrect approach involves immediately offering a detailed prescriptive plan. This fails to acknowledge the client's expressed ambivalence and bypasses the crucial MI step of exploring their readiness for change. Ethically, this can be perceived as paternalistic and disempowering, undermining the client's autonomy. It also risks creating a plan that the client is not yet ready to commit to, leading to potential failure and demotivation, which is counterproductive to effective coaching. Another incorrect approach is to dismiss the client's concerns and push forward with the original plan. This disregards the client's expressed feelings and can damage the coaching relationship. It violates the principle of empathy and active listening, fundamental to MI and ethical coaching. From a regulatory perspective, failing to adapt to a client's expressed needs and readiness can be seen as unprofessional conduct, as it does not prioritize the client's well-being and self-determination. A third incorrect approach might be to suggest the client is not ready for coaching and terminate the session abruptly. While a coach must operate within their scope, an abrupt termination without exploring the ambivalence or offering alternative support, if within scope, can be seen as abandoning the client. Ethical coaching involves attempting to understand and work through resistance, rather than immediately disengaging when faced with it. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client-centeredness, autonomy, and evidence-based practices. When faced with client ambivalence, the first step is to acknowledge and explore it using techniques like open-ended questions, affirmations, reflections, and summaries ORs, which are foundational to MI. The coach should then assess the client's readiness for change and collaboratively adjust the coaching plan accordingly. If the client's needs fall outside the CHC's scope of practice, the professional should ethically refer them to appropriate resources, but not before attempting to understand and address the immediate coaching challenge. Question 7. System analysis indicates a certified health coach, CHC, is working with a client who expresses a desire to improve their diet and increase physical activity, but consistently finds reasons not to start, often stating, "I know I should, but I'm just too busy right now," or "maybe next month will be better." The CHC has provided educational materials and suggested specific meal plans and exercise routines. Which of the following approaches best reflects an understanding of the client's likely stage of change and promotes effective coaching? Option A. Provide more detailed information on the benefits of healthy eating and exercise, assuming that increased knowledge will eventually lead to action. Option B. Acknowledge the client's ambivalence, explore the barriers they perceive, and collaboratively identify small, manageable steps that align with their current lifestyle and beliefs, focusing on building motivation and self-efficacy. Option C. Persistently encourage the client to commit to a strict diet and exercise plan immediately, emphasizing the long-term health consequences of inaction to motivate them. Option D. Express frustration with the client's lack of progress and suggest they are not ready for coaching, recommending they return when they are more committed. The correct answer is B. Acknowledge the client's ambivalence, explore the barriers they perceive, and collaboratively identify small, manageable steps that align with their current lifestyle and beliefs, focusing on building motivation and self-efficacy. Explanation. This scenario presents a common implementation challenge for health coaches. A client who is resistant to change, despite expressing a desire for improvement. The professional challenge lies in accurately assessing the client's readiness and tailoring interventions accordingly, rather than imposing a one-size-fits-all approach. This requires a deep understanding of behavioral change theories and ethical coaching practices. The correct approach involves recognizing the client's current stage of change and employing strategies that meet them where they are. For a client in the pre-contemplation or contemplation stage, the focus should be on raising awareness, exploring ambivalence, and building motivation, rather than pushing for immediate action. This aligns with the ethical principle of client autonomy and the regulatory expectation that health coaches operate within their scope of practice, which includes facilitating self-discovery and empowerment. Best professional practice dictates a client-centered, stage-matched intervention. An incorrect approach would be to ignore the client's expressed ambivalence and push for immediate action planning. This fails to acknowledge the client's current readiness and can lead to frustration, demotivation, and a breakdown in the coaching relationship. Ethically, this could be seen as coercive and not in the client's best interest, potentially violating principles of beneficence and non-maleficence. From a regulatory standpoint, it might indicate a lack of competence in applying behavioral change models, which could be a concern if the CHC is expected to demonstrate proficiency in such areas. Another incorrect approach would be to solely focus on providing information about healthy behaviors without assessing the client's willingness to consider or act on that information. While education is part of health coaching, without stage matching, it can be perceived as lecturing and may not lead to sustainable change. This approach neglects the motivational aspect crucial for moving through the stages of change and could be seen as a failure to engage the client effectively, potentially falling short of professional standards for client engagement. Finally, an incorrect approach might involve the coach becoming overly directive or judgmental when the client expresses doubts. This can shut down communication, erode trust, and reinforce the client's resistance. Ethically, this is detrimental to the therapeutic alliance and can be perceived as a failure to maintain a supportive and non-judgmental stance, which is fundamental to effective health coaching. The professional decision-making process should involve 1. Active listening to understand the client's perspective and identify their current stage of change. 2. Applying knowledge of the stages of change model to select appropriate coaching strategies. 3. Collaborating with the client to set realistic goals and develop a plan that respects their readiness. 4. Regularly reassessing the client's stage and adjusting the approach as needed. Question 8. Examination of the data shows a certified health coach, CHC, is working with a client who verbally expresses strong motivation to adopt a new healthy eating plan. However, throughout the session, the client exhibits slumped posture, avoids eye contact, and frequently sighs. When the coach asks about the client's readiness to begin, the client reiterates their commitment, but continues to display these nonverbal signs of disengagement or apprehension. What is the most ethically and professionally appropriate response for the CHC in this situation? Option A. Proceed with outlining the detailed steps of the healthy eating plan, assuming the client's verbal commitment is sufficient and that the nonverbal cues are not significant barriers. Option B. Gently acknowledge the observed nonverbal cues and invite the client to explore their feelings about the plan, stating something like, "I notice you're saying you're ready, and I also sense some hesitation. Can you tell me more about what's coming up for you right now?" Option C. Change the subject to a less challenging topic, such as the client's current exercise routine, to avoid making the client uncomfortable about their perceived lack of readiness. Option D. Directly tell the client, "Your body language suggests you're not really ready for this change, and you need to be more committed if we're going to succeed." The correct answer is B. Gently acknowledge the observed nonverbal cues and invite the client to explore their feelings about the plan, stating something like, "I notice you're saying you're ready, and I also sense some hesitation. Can you tell me more about what's coming up for you right now?" Explanation. Scenario analysis. This scenario presents a professional challenge because the health coach must interpret and respond to a client's nonverbal cues that contradict their verbal statements. The client's expressed desire to change is at odds with their body language, which suggests resistance or discomfort. A health coach's role involves building trust and facilitating client-led change, which requires accurately assessing the client's readiness and emotional state. Misinterpreting or ignoring these nonverbal signals can lead to ineffective coaching, client disengagement, and a breakdown in the therapeutic alliance. Correct approach analysis. The correct approach involves acknowledging the discrepancy between verbal and nonverbal communication in a non-judgmental and curious manner. This demonstrates active listening and empathy, crucial elements for building rapport and trust as outlined in ethical coaching guidelines. By gently probing the client's feelings, the coach creates a safe space for the client to explore their internal conflict. This aligns with the principle of client autonomy, allowing the client to lead the conversation and identify their own barriers to change. This approach respects the client's pace and readiness, fostering a collaborative partnership essential for sustainable health behavior change. Incorrect approaches analysis. One incorrect approach involves proceeding with the coaching plan as if the client's verbal statements are the sole determinant of their readiness. This fails to acknowledge the importance of nonverbal communication in understanding a client's true feelings and motivations. Ethically, this can be seen as a failure to provide competent and client-centered care, as it overlooks crucial data points that inform the coaching process. It can lead to the client feeling unheard or misunderstood, potentially damaging the coaching relationship and hindering progress. Another incorrect approach is to directly confront the client about their nonverbal cues in an accusatory or judgmental way. This can put the client on the defensive, shut down communication, and erode trust. Ethically, this violates principles of respect and non-maleficence, as it can cause emotional distress and create an adversarial dynamic rather than a supportive one. It fails to recognize that nonverbal cues are often subconscious and may not be readily understood or articulated by the client. Third incorrect approach is to ignore the nonverbal cues entirely and change the subject. This is a passive avoidance of a critical aspect of the client's communication. It suggests a lack of observational skill or an unwillingness to engage with the client's full experience. This can lead to superficial coaching, where underlying issues that impede progress are never addressed, ultimately failing to serve the client's best interests and potentially violating the coach's duty of care. Professional reasoning. When faced with conflicting verbal and nonverbal communication, a health coach should employ a process of mindful observation, empathetic inquiry, and collaborative exploration. The coach should first observe the nonverbal cues without immediate judgment. Then, they should consider how these cues might relate to the client's verbal statements. The next step is to formulate a gentle, open-ended question that acknowledges the potential discrepancy and invites the client to share their feelings or thoughts. This might involve phrases like, "I notice you're saying you're ready to make this change, and I also sense some hesitation. Can you tell me more about what's coming up for you right now?" This approach prioritizes the client's experience, fosters self-discovery, and ensures that the coaching is responsive to the client's actual state of readiness and emotional landscape. Question 9. Performance analysis shows a health coaching client expresses significant distress during a session, stating, "I just feel so overwhelmed and hopeless. I don't see the point in anything anymore, and I've been thinking about not being here." As a certified health coach, CHC, what is the most appropriate immediate course of action? Option A. Continue with the planned health coaching session, making a note to follow up with the client about their feelings later in the week. Option B. Reassure the client that these feelings are common and encourage them to focus on their health goals, suggesting they will feel better once they achieve them. Option C. Acknowledge the client's feelings and suggest they try some deep breathing exercises and mindfulness techniques to calm down before continuing the session. Option D. Immediately refer the client to a mental health crisis hotline or emergency services and inform them of the referral while suspending the current coaching session. The correct answer is D. Immediately refer the client to a mental health crisis hotline or emergency services and inform them of the referral while suspending the current coaching session. Explanation. This scenario presents a professional challenge because the health coach is faced with a client who is experiencing significant emotional distress and expressing thoughts of self-harm. This situation transcends typical health coaching boundaries and enters the realm of mental health crisis intervention. The health coach's primary responsibility is to promote the client's well-being, which includes recognizing the limits of their professional scope and ensuring the client receives appropriate care. The correct approach represents best professional practice because it prioritizes the client's immediate safety and well-being by connecting them with qualified mental health professionals. Certified health coaches, CHC, operate within a defined scope of practice, which does not include diagnosing or treating mental health conditions or providing crisis intervention. Ethical guidelines and regulatory frameworks for CHCs emphasize the importance of client safety and the need to refer clients to appropriate resources when their needs exceed the coach's expertise. This approach aligns with the CHC's ethical obligation to act in the client's best interest and to practice within their competence. An incorrect approach that involves attempting to provide direct psychological counseling or crisis intervention would be a significant ethical and regulatory failure. CHCs are not trained or licensed to provide such services. This could lead to inadequate care, potential harm to the client, and legal repercussions for the coach. Another incorrect approach, such as dismissing the client's concerns or simply advising them to stay positive, would be a failure to recognize a serious mental health risk and a dereliction of the coach's duty of care. This demonstrates a lack of understanding of the severity of the situation and a failure to adhere to ethical principles of client welfare. A further incorrect approach, such as continuing with the planned health coaching session without addressing the immediate crisis, ignores the client's urgent need and prioritizes the coaching agenda over the client's safety, which is a clear ethical breach. The professional decision-making process for similar situations should involve a clear protocol for recognizing and responding to potential mental health crises. This includes understanding the boundaries of the health coaching scope of practice, having readily available resources for referrals to mental health professionals, therapists, counselors, crisis hotlines, and knowing when and how to make an appropriate and timely referral. The coach must remain calm, empathetic, and focused on ensuring the client's safety above all else. Question 10. The audit findings indicate that a health coach's client has consistently failed to implement recommended lifestyle changes, despite understanding the rationale behind them. The client expresses frustration and a sense of being overwhelmed, stating, "I know what I should do, but I just can't seem to make myself do it." The coach has been providing detailed educational materials and step-by-step instructions. Which of the following approaches best addresses the client's situation by fostering intrinsic motivation according to self-determination theory? Option A. Take a more directive approach, outlining a clear, non-negotiable plan of action and setting firm deadlines for each step to ensure compliance. Option B. Reevaluate the client's understanding of the health information and provide more in-depth explanations of the scientific evidence supporting the recommendations. Option C. Collaboratively explore the client's personal values and intrinsic reasons for wanting to make these changes, and then co-create a plan that offers choices and opportunities for the client to experience success and build confidence in their abilities. Option D. Increase the frequency of reminders and accountability check-ins, emphasizing the importance of adhering to the prescribed plan to achieve the desired health outcomes. The correct answer is C. Collaboratively explore the client's personal values and intrinsic reasons for wanting to make these changes, and then co-create a plan that offers choices and opportunities for the client to experience success and build confidence in their abilities. Explanation. The audit findings indicate a potential gap in how health coaches are supporting client autonomy, a core tenet of self-determination theory, SDT. This scenario is professionally challenging because it requires coaches to move beyond simply providing information or directives to actively fostering an environment where clients feel empowered to make their own choices and pursue their own goals. The challenge lies in balancing expert guidance with the client's inherent need for competence, autonomy, and relatedness. The correct approach represents best professional practice because it directly aligns with the principles of SDT and ethical coaching standards. By focusing on collaborative goal setting, exploring the client's intrinsic motivations, and providing tailored support that enhances their sense of competence, the coach actively nurtures the client's autonomy. This approach respects the client's right to self-determination, which is crucial for sustainable behavior change and overall well-being. It also implicitly adheres to professional guidelines that emphasize client-centered care and evidence-based practices, as SDT is a well-established psychological framework for understanding motivation. An incorrect approach that focuses solely on providing a detailed, prescriptive plan without client input fails to acknowledge the client's need for autonomy. This can lead to feelings of external control and decreased intrinsic motivation, undermining the coaching relationship and the likelihood of long-term success. Ethically, this approach could be seen as paternalistic and not in line with client-centered care principles. Another incorrect approach that involves the coach making decisions for the client based on perceived best interests without engaging in a dialogue about the client's values and preferences, also violates the principle of autonomy. This can erode trust and create a dependency on the coach, rather than empowering the client to become self-directed. This approach risks overstepping professional boundaries and not respecting the client's capacity for self-governance. A third incorrect approach that prioritizes the coach's agenda or the perceived quickest path to results, without adequately exploring the client's internal drivers and barriers, neglects the importance of relatedness and competence. If the client doesn't feel understood or capable of achieving the goals, their engagement will likely wane. This approach can lead to superficial compliance rather than genuine commitment. Professionals should employ a decision-making framework that begins with understanding the client's individual needs and motivations through active listening and open-ended questioning. This involves assessing the client's current level of autonomy and identifying areas where support for competence, autonomy, and relatedness can be enhanced. The coach should then collaboratively develop strategies that align with the client's values and intrinsic motivations, providing opportunities for choice and self-direction, and offering constructive feedback that builds a sense of mastery. This iterative process ensures that the coaching remains client-centered and grounded in SDT principles. Question 11. Analysis of a health coach's interaction with a new client reveals that after explaining a complex dietary change recommended by the client's physician, the coach provided a printed handout and asked, "Do you have any questions?" The client nodded and stated, "Yes, I understand." Which of the following approaches best demonstrates a commitment to optimizing health literacy and ensuring client comprehension? Option A. Providing additional pamphlets on related topics and assuming the client will review them at their convenience. Option B. Relying on the client's affirmative nod and verbal confirmation as sufficient evidence of understanding. Option C. Using more technical medical terms to ensure the client is exposed to accurate terminology. Option D. Asking the client to explain the dietary change in their own words and then asking clarifying, open-ended questions about how they plan to implement it. Correct answer is D. Asking the client to explain the dietary change in their own words and then asking clarifying, open-ended questions about how they plan to implement it. Explanation. This scenario presents a professional challenge because a health coach must navigate the complexities of ensuring a client understands vital health information, which directly impacts their ability to make informed decisions about their well-being. The coach's responsibility extends beyond simply delivering information. It involves assessing and addressing the client's comprehension level, a core tenet of ethical health coaching practice. The challenge is amplified by the potential for misinterpretation or lack of understanding, which could lead to non-adherence to recommendations or even harmful health outcomes. Careful judgment is required to tailor communication strategies effectively. The correct approach represents best professional practice because it prioritizes the client's autonomy and safety by actively verifying understanding. This aligns with the ethical guidelines for health coaches, which emphasize clear communication and client empowerment. By using teach-back methods and open-ended questions, the coach ensures that the client can articulate the information in their own words, demonstrating genuine comprehension rather than passive reception. This proactive verification is crucial for building trust and ensuring the client can effectively implement the health strategies discussed, thereby promoting positive health outcomes. This approach is foundational to client-centered care and adheres to the spirit of promoting health literacy as a means of enabling self-management. An incorrect approach that involves simply providing a pamphlet and assuming the client will understand fails to meet the professional standard of care. This approach neglects the responsibility to assess comprehension and can lead to a significant gap between information provided and information understood. Ethically, this is a failure to adequately support the client's decision-making process and could be seen as a dereliction of duty to ensure the client is equipped to act on the information. It overlooks the diverse learning styles and existing health literacy levels of individuals. Another incorrect approach, which involves using complex medical jargon and assuming the client's background knowledge, is also professionally unacceptable. This demonstrates a lack of empathy and an inability to adapt communication to the client's needs. It creates a barrier to understanding, potentially leading to frustration, disengagement, and a failure to follow through on health recommendations. This approach violates the principle of clear and accessible communication, which is paramount in health coaching. It can inadvertently disempower the client and undermine their confidence in managing their health. The professional decision-making process for similar situations should involve a continuous assessment of the client's understanding throughout the coaching relationship. This includes employing a variety of communication techniques, actively seeking feedback, and being prepared to re-explain information in different ways. Professionals should always prioritize clarity, simplicity, and the client's perspective, ensuring that information is not only delivered, but also understood and actionable. This iterative process of communication and verification is key to effective health coaching and upholding ethical responsibilities. Question 12. The evaluation methodology shows a health coach working with a client who expresses a strong desire to incorporate a specific, unproven dietary supplement into their regimen, citing anecdotal evidence from online sources. The health coach has reviewed the available scientific literature and found no credible evidence to support the supplement's efficacy or safety for the client's stated goals. The coach is also aware that the supplement is not regulated by the FDA for efficacy claims. Which of the following represents the most ethically sound and professionally responsible course of action for the health coach? Option A. Recommend the supplement to the client, emphasizing that while scientific evidence is limited, the client's personal belief in its effectiveness is important for motivation. Option B. Gently explain to the client that there is a lack of scientific evidence supporting the supplement's effectiveness and safety. Discuss the potential risks associated with unregulated supplements, and collaboratively explore evidence-based strategies that align with their health goals. Option C. Advise the client to consult with their physician about the supplement, but do not offer any further guidance or alternatives, leaving the client to make their own decisions without support. Option D. Directly recommend the supplement to the client, assuring them that if it has positive anecdotal reviews, it is likely safe and effective for their needs. The correct answer is B. Gently explain to the client that there is a lack of scientific evidence supporting the supplement's effectiveness and safety. Discuss the potential risks associated with unregulated supplements, and collaboratively explore evidence-based strategies that align with their health goals. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed desire and the health coach's ethical obligation to provide evidence-based and safe guidance. The health coach must navigate the client's personal beliefs and preferences while upholding professional standards that prioritize client well-being and avoid harm. The core of the challenge lies in balancing client autonomy with the coach's responsibility to offer accurate, scientifically supported advice. The correct approach represents best professional practice because it prioritizes the client's safety and well-being by grounding recommendations in evidence and professional scope of practice. It upholds the ethical principle of non-maleficence, do no harm, by not endorsing potentially harmful or unproven interventions. Furthermore, it demonstrates respect for client autonomy by engaging in open dialogue, providing accurate information, and empowering the client to make informed decisions based on reliable data, rather than blindly following a client's potentially misinformed request. This aligns with the ethical guidelines that mandate coaches to practice within their scope of competence and to refer clients to other professionals when necessary. An incorrect approach that involves directly recommending or endorsing the unproven supplement without any caveats or further investigation would be a significant ethical and regulatory failure. This would violate the principle of beneficence, acting in the client's best interest, by potentially exposing the client to ineffective or harmful substances. It also breaches the ethical standard of practicing within one's scope of competence, as health coaches are not qualified to prescribe or endorse specific supplements without robust evidence, and in many cases, medical oversight. Another incorrect approach, such as dismissing the client's request outright without explanation or empathy, would fail to uphold the ethical standard of client-centered care and effective communication, potentially damaging the therapeutic relationship and hindering the client's engagement with evidence-based strategies. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and acknowledge the client's request and underlying concerns. Second, assess the request against current scientific evidence and the coach's scope of practice. Third, if the request involves unproven or potentially harmful interventions, clearly and empathetically explain the lack of evidence or potential risks, citing credible sources. Fourth, offer evidence-based alternatives and collaboratively develop a plan that aligns with the client's goals and is supported by scientific consensus. Finally, be prepared to refer the client to a qualified healthcare professional if the situation warrants medical advice or intervention. Question 13. Compliance review shows a health coach is working with a client who expresses frustration about their inability to consistently exercise. The client states, "I just can't seem to get myself to go to the gym, no matter how hard I try. It feels impossible." Which of the following active listening techniques would be most appropriate for the coach to employ next to facilitate deeper exploration and client-centered problem solving? Option A. Immediately suggesting a new workout routine and offering to create a detailed schedule for the client. Option B. Reflecting the client's feelings and asking an open-ended question about what impossible feels like for them. Option C. Interrupting the client to ask if they have considered the financial cost of a gym membership as a potential barrier. Option D. Sharing personal anecdotes about the coach's own struggles with exercise motivation to build rapport. Correct answer is B. Reflecting the client's feelings and asking an open-ended question about what impossible feels like for them. Explanation. This scenario presents a professional challenge because the health coach must balance the client's expressed desire for immediate solutions with the ethical imperative to facilitate self-discovery and sustainable behavior change. Rushing to provide answers without fully understanding the client's underlying motivations, barriers, and personal context can lead to ineffective strategies, client disengagement, and a failure to uphold the coach's professional responsibilities. Careful judgment is required to ensure the coaching process is client-centered and empowering. The correct approach represents best professional practice because it prioritizes active listening and empathetic inquiry. By reflecting the client's statements, asking open-ended questions, and summarizing to ensure understanding, the coach creates a safe space for the client to explore their thoughts and feelings more deeply. This aligns with the core principles of health coaching, which emphasize collaboration, client autonomy, and the co-creation of solutions. This method fosters self-awareness and intrinsic motivation, leading to more sustainable health behavior changes, which is a key ethical and professional objective. An incorrect approach that immediately offers solutions without thorough exploration fails to acknowledge the client's agency and can inadvertently disempower them. This can lead to a superficial understanding of the problem, resulting in recommendations that are not tailored to the client's unique circumstances, potentially leading to frustration and non-adherence. Ethically, this approach risks a breach of professional competence by not adequately assessing the client's needs before intervening. Another incorrect approach that focuses solely on the coach's expertise, rather than the client's experience, undermines the collaborative nature of coaching. This can create a hierarchical dynamic where the client feels lectured rather than supported, hindering trust and rapport. It also fails to leverage the client's own knowledge and insights, which are crucial for successful behavior change. This approach can be seen as a failure to adhere to ethical guidelines that mandate client-centered practice. A third incorrect approach that interrupts the client frequently to offer advice or redirect the conversation demonstrates a lack of respect for the client's narrative and can shut down communication. This prevents the coach from gathering crucial information and can make the client feel unheard and invalidated. This directly contradicts the ethical requirement to practice with integrity and to foster a supportive coaching relationship. The professional decision-making process for similar situations should involve a conscious commitment to active listening as the foundational element of every session. This means suspending judgment, focusing fully on the client, and employing techniques like paraphrasing, reflecting feelings, and asking clarifying questions. The coach should continually assess their own internal dialogue to ensure they are not projecting their own biases or rushing to conclusions. The goal is to facilitate the client's own insights and solutions, rather than imposing them. Question 14. Research into the effectiveness of various nutrition assessment techniques reveals a client diagnosed with type 2 diabetes and hypertension, who is seeking guidance on managing their diet to improve blood sugar control and blood pressure. The client has previously attempted several restrictive diets with limited success and expresses confusion about conflicting dietary information. As a certified health coach, what is the most appropriate initial step in addressing this client's nutritional needs? Option A. Develop a detailed, personalized meal plan incorporating specific macronutrient targets and calorie recommendations based on general healthy eating principles. Option B. Conduct a detailed dietary recall and food frequency questionnaire to identify all potential nutrient deficiencies and excesses before offering any advice. Option C. Provide the client with a list of general healthy food choices and advise them to focus on portion control without addressing their specific medical conditions. Option D. Refer the client to a registered dietitian nutritionist for a comprehensive medical nutrition therapy assessment and personalized meal planning. The correct answer is D. Refer the client to a registered dietitian nutritionist for a comprehensive medical nutrition therapy assessment and personalized meal planning. Explanation. This scenario presents a professional challenge because the health coach must navigate the ethical and regulatory boundaries of their scope of practice when a client presents with complex dietary needs that may border on medical nutrition therapy. The health coach's role is to support lifestyle and behavior change, not to diagnose or treat medical conditions. Therefore, the coach must exercise careful judgment to ensure they are providing appropriate support without overstepping their qualifications, which could lead to harm to the client and regulatory noncompliance. The correct approach represents best professional practice because it prioritizes client safety and adheres to the established scope of practice for a certified health coach. By recognizing the limitations of their expertise and referring the client to a registered dietitian nutritionist, RDN, the health coach ensures the client receives appropriate, evidence-based medical nutrition therapy for their diagnosed condition. This aligns with ethical guidelines that mandate professionals practice within their competence and refer when necessary. It also upholds regulatory frameworks that define the distinct roles of health coaches and RDNs, preventing the unauthorized practice of dietetics. An incorrect approach of attempting to create a detailed meal plan for the client's specific condition fails to acknowledge the health coach's scope of practice. This constitutes a regulatory and ethical failure as it ventures into medical nutrition therapy, which is the domain of licensed professionals like RDNs. Such an action could lead to the provision of inaccurate or inappropriate dietary advice, potentially exacerbating the client's condition or interfering with their medical treatment, thereby causing harm. Furthermore, it violates ethical principles of competence and integrity by practicing outside of established professional boundaries. Another incorrect approach of providing general healthy eating advice without acknowledging the client's diagnosed condition is also ethically and regulatorily problematic. While general advice is within scope, failing to recognize and address the specific dietary implications of a diagnosed medical condition demonstrates a lack of professional diligence and awareness of the client's unique needs. This could lead to the client not receiving the specialized nutritional guidance necessary for managing their health, potentially hindering their progress and failing to act in the client's best interest. It also risks misinterpreting the severity or complexity of the client's situation, which is an ethical lapse. The professional decision-making process for similar situations should involve a clear understanding of the health coach's scope of practice, ethical guidelines, and relevant regulations. When a client presents with a diagnosed medical condition that requires specific dietary interventions, the health coach should first acknowledge the condition and its potential nutritional implications. The next critical step is to assess whether the client's needs fall within the health coach's expertise. If the situation requires medical nutrition therapy, diagnosis, or treatment of a medical condition through diet, the professional and ethical course of action is to refer the client to an appropriate healthcare professional, such as a registered dietitian nutritionist. Throughout this process, maintaining open communication with the client about the referral and the coach's role is paramount. Question 15. The monitoring system demonstrates that a client who has been advised on general healthy eating principles is consistently consuming very high amounts of cruciferous vegetables and is experiencing significant gastrointestinal discomfort, including bloating and gas, despite reporting no other adverse symptoms. Option A. Advise the client that gastrointestinal discomfort is a common side effect of increased fiber intake and encourage them to continue with their current diet, as it is generally considered healthy. Option B. Recommend the client reduce their intake of cruciferous vegetables and explore alternative nutrient-dense food sources, while advising them to monitor their symptoms and consult a physician if discomfort persists. Option C. Immediately refer the client to a registered dietitian for a comprehensive dietary assessment and to rule out any underlying medical conditions contributing to their symptoms. Option D. Suggest specific over-the-counter digestive enzyme supplements that may help alleviate the bloating and gas associated with high fiber consumption. The correct answer is B. Recommend the client reduce their intake of cruciferous vegetables and explore alternative nutrient-dense food sources, while advising them to monitor their symptoms and consult a physician if discomfort persists. Explanation: this scenario presents a professional challenge because the health coach is observing a client's dietary intake that, while seemingly healthy in isolation, may not be meeting the client's specific physiological needs or could be contributing to an underlying, undiagnosed issue. The health coach must balance providing general nutritional guidance with recognizing the limits of their scope of practice and the potential need for referral to a registered dietitian or physician. Careful judgment is required to avoid overstepping professional boundaries while still offering supportive and evidence-based advice. The correct approach represents best professional practice because it prioritizes client safety and well-being by acknowledging the limitations of the health coach's expertise in diagnosing or treating specific medical conditions. It aligns with ethical guidelines that mandate health coaches to practice within their scope and refer clients to appropriate healthcare professionals when necessary. This approach ensures that the client receives the most accurate and comprehensive care, potentially involving medical assessment and specialized dietary planning. An incorrect approach that involves directly recommending specific supplements without a thorough understanding of the client's medical history and potential interactions would be a significant ethical and potentially regulatory failure. Health coaches are not qualified to prescribe or recommend specific supplements for therapeutic purposes, as this falls under the purview of licensed medical professionals. Another incorrect approach, such as dismissing the observed pattern as insignificant without further inquiry, fails to uphold the duty of care owed to the client and could lead to delayed diagnosis or management of a health issue. Professionals should employ a decision-making framework that begins with active listening and observation, followed by open-ended questioning to gather more information. If the observed pattern suggests a potential health concern beyond general wellness, the next step is to assess whether it falls within the scope of practice. If it does not, or if there is any doubt, the professional, ethical, and regulatory imperative is to refer the client to a qualified healthcare provider, such as a physician or registered dietitian, clearly explaining the rationale for the referral. Question 16. Benchmark analysis indicates that a certified health coach is working with a client who expresses a strong desire to quit smoking, but also voices significant self-doubt, citing multiple previous unsuccessful attempts. The client states, "I know I should quit, but I just don't think I can do it this time either. It always feels too hard." Which of the following approaches best aligns with ethical and effective cognitive behavioral coaching principles in this situation? Option A. Immediately provide the client with a detailed, structured plan for quitting smoking, emphasizing the health risks and the urgency of immediate action to overcome their doubts. Option B. Assure the client that you have a proven, guaranteed method that will ensure their success in quitting smoking, regardless of their past experiences. Option C. Collaboratively explore the client's past experiences with quitting, identifying specific triggers and thought patterns that contributed to previous attempts, and then co-create small, manageable behavioral goals focused on building self-efficacy. Option D. Focus exclusively on the negative health consequences of continued smoking, aiming to create a sense of urgency and fear that will motivate the client to quit. The correct answer is C. Collaboratively explore the client's past experiences with quitting, identifying specific triggers and thought patterns that contributed to previous attempts, and then co-create small, manageable behavioral goals focused on building self-efficacy. Explanation: scenario analysis. This scenario presents a common challenge for health coaches where a client expresses a desire to change a deeply ingrained behavior, smoking, but also exhibits significant self-doubt and a history of failed attempts. The professional challenge lies in balancing encouragement with realistic expectations, and in applying cognitive behavioral techniques effectively without overstepping the scope of practice or making unsubstantiated claims. The coach must navigate the client's emotional state and cognitive distortions while adhering to ethical guidelines and the principles of cognitive behavioral coaching. Correct approach analysis. The correct approach involves collaboratively exploring the client's readiness for change, identifying specific triggers and thought patterns associated with smoking, and then co-creating small, achievable behavioral goals. This aligns with the core tenets of cognitive behavioral coaching, CBC, which emphasizes empowering the client to identify and modify maladaptive thoughts and behaviors. By focusing on the client's self-efficacy and building on past experiences, even failures, as learning opportunities, the coach fosters a sense of control and agency. This approach is ethically sound as it respects client autonomy, avoids directive or prescriptive advice, and operates within the scope of coaching by facilitating self-discovery and skill building, rather than providing therapy or medical advice. It adheres to the principle of do no harm, by not pushing the client into a change they are not ready for, which could lead to further discouragement. Incorrect approaches analysis. One incorrect approach would be to immediately prescribe a rigid, multi-step plan for quitting smoking, emphasizing the urgency of the situation and downplaying the client's expressed doubts. This fails to acknowledge the client's current stage of change and can be perceived as dismissive of their lived experience and self-efficacy. Ethically, this is problematic as it can undermine the client's autonomy and potentially lead to feelings of failure if they cannot adhere to the imposed plan. It also risks overstepping the coaching scope by acting as an authority figure, dictating solutions rather than a facilitator. Another incorrect approach would be to focus solely on the negative consequences of smoking, without exploring the client's motivations for change or their perceived barriers. While awareness of consequences is important, an unbalanced focus can increase anxiety and hopelessness, further reinforcing negative self-talk and potentially leading to avoidance. This approach neglects the cognitive aspect of identifying and challenging unhelpful thought patterns that contribute to the behavior. Ethically, it can be seen as manipulative or overly fear-based, which is not conducive to a supportive coaching relationship. A third incorrect approach would be to suggest that the coach has a guaranteed method or a magic bullet to help the client quit smoking, implying a level of expertise beyond that of a certified health coach. This is a direct violation of ethical guidelines regarding scope of practice and professional integrity. It is misleading and sets unrealistic expectations, which can lead to significant disappointment and damage the client's trust in the coaching process and their own ability to achieve goals. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes client-centeredness, ethical adherence, and evidence-based coaching practices. This involves 1. Active listening and empathy, fully understanding the client's perspective, including their doubts and past experiences. 2. Collaborative goal setting, working with the client to define achievable goals that align with their readiness for change. 3. Application of cognitive behavioral principles, guiding the client to identify and challenge unhelpful thoughts and develop coping strategies, always within the coaching scope. 4. Ethical self-awareness, continuously assessing one's own scope of practice and avoiding the temptation to provide advice or solutions that belong to other professions. 5. Iterative process, recognizing that behavior change is often a journey with setbacks and adapting the coaching approach as needed based on client progress and feedback. Question 17. Which approach would be most appropriate for a certified health coach when a client expresses health goals that are deeply intertwined with their cultural traditions and beliefs, which differ significantly from mainstream Western health practices? Option A. Actively seek to understand the client's cultural beliefs and values and collaboratively integrate them into the coaching plan, exploring how these traditions can support their health goals. Option B. Acknowledge the client's cultural beliefs but focus primarily on established, universally recognized health guidelines to ensure the most effective outcomes. Option C. Express concern that the client's cultural practices might hinder their progress and encourage them to prioritize conventional health advice over traditional beliefs. Option D. Gently suggest that the client consider adopting more evidence-based health practices, explaining the scientific rationale behind them, even if it means deviating from their cultural traditions. The correct answer is A. Actively seek to understand the client's cultural beliefs and values, and collaboratively integrate them into the coaching plan, exploring how these traditions can support their health goals. Explanation. This scenario presents a professional challenge because a health coach must navigate a client's deeply held cultural beliefs about health and wellness without imposing their own worldview or making assumptions. The coach's role is to support the client's goals, which are intrinsically linked to their cultural identity. Misunderstanding or disrespecting these beliefs can lead to a breakdown in trust, client disengagement, and ultimately, failure to achieve health goals. Careful judgment is required to ensure the coaching relationship is built on respect and understanding. The correct approach represents best professional practice because it prioritizes client-centered care and cultural humility. By actively seeking to understand the client's cultural context and integrating it into the coaching plan, the coach demonstrates respect for the client's autonomy and values. This aligns with ethical guidelines that emphasize non-maleficence and beneficence, ensuring the client's well-being is paramount. It also fosters a collaborative partnership where the client feels heard and valued, increasing their motivation and adherence to the plan. This approach is consistent with the principles of culturally competent practice, which are increasingly recognized as essential in health and wellness professions. An incorrect approach that dismisses or minimizes the client's cultural beliefs is ethically unsound. It demonstrates a lack of cultural competence and can be perceived as disrespectful or judgmental, violating the principle of respect for persons. This can lead to a damaged therapeutic alliance and potentially cause psychological distress to the client. Another incorrect approach that attempts to educate the client out of their cultural beliefs without understanding or consent is paternalistic and undermines the client's self-determination. This violates the ethical principle of autonomy, which dictates that clients have the right to make their own informed decisions about their health. Furthermore, imposing external health paradigms without considering the client's cultural framework can be ineffective and even harmful, as it may not align with their lived experiences or available resources. Professionals should employ a decision-making framework that begins with active listening and open-ended questioning to understand the client's perspective, including their cultural background and beliefs related to health. This should be followed by a process of collaborative goal setting, where the coach and client work together to develop strategies that are culturally relevant and personally meaningful to the client. If there are potential conflicts between cultural beliefs and evidence-based health practices, the coach should facilitate a discussion about these differences with sensitivity and respect, exploring potential compromises or alternative approaches that honor both the client's values and their health objectives. Question 18. The review process indicates a certified health coach, CHC, has been working with a client on a goal of increasing daily physical activity. The client has consistently reported not meeting the agreed-upon targets for the past 2 weeks, expressing feelings of being overwhelmed and lacking motivation. The CHC needs to determine the most appropriate next step in their coaching session. Option A. Immediately propose a significantly more intense exercise regimen, assuming the current plan is too easy. Option B. Explore the client's feelings about the current situation and collaboratively identify specific barriers contributing to the lack of progress, then adjust the plan together. Option C. Acknowledge the client's report but proceed with the original plan, assuming the client will eventually catch up. Option D. Directly challenge the client's commitment to the goal, emphasizing the importance of discipline and adherence to the original plan. The correct answer is B. Explore the client's feelings about the current situation and collaboratively identify specific barriers contributing to the lack of progress, then adjust the plan together. Explanation. This scenario presents a professional challenge because the certified health coach, CHC, must navigate a client's resistance to a recommended behavior change while adhering to ethical guidelines and the scope of practice. The CHC needs to assess the underlying reasons for the resistance without overstepping boundaries or making assumptions, ensuring the client remains empowered in their health journey. Careful judgment is required to balance support with the client's autonomy. The correct approach represents best professional practice because it prioritizes understanding the client's perspective and collaboratively identifying barriers. This aligns with the CHC's ethical responsibility to foster self-efficacy and autonomy in clients. By exploring the client's feelings and perceived obstacles, the CHC can tailor strategies that are more likely to be sustainable and effective, respecting the client's readiness for change. This approach is grounded in motivational interviewing principles, which are foundational to effective health coaching and are implicitly supported by the ethical codes governing health coaching, emphasizing client-centered care and partnership. An incorrect approach that involves directly confronting the client about their perceived lack of commitment would be professionally unacceptable. This could be perceived as judgmental and may alienate the client, undermining the trust essential for a coaching relationship. Ethically, it fails to uphold the principle of non-maleficence by potentially causing distress or demotivation. Another incorrect approach, such as immediately suggesting a different, more drastic intervention without understanding the current resistance, bypasses the crucial step of client exploration and collaboration. This disregards the client's current readiness and may lead to a solution that is not aligned with their values or capabilities, violating the principle of client autonomy. A third incorrect approach, which involves dismissing the client's concerns and proceeding with the original plan, ignores the client's expressed experience and can lead to disengagement and a breakdown of the coaching relationship, failing to meet the ethical standard of responsive and client-centered support. Professionals should employ a decision-making framework that begins with active listening and empathetic inquiry when faced with client resistance. The CHC should seek to understand the why behind the resistance, exploring the client's thoughts, feelings, and perceived barriers. This involves asking open-ended questions and reflecting back what is heard to ensure accurate understanding. Based on this understanding, the CHC can then collaboratively problem-solve with the client, co-creating strategies that address the identified obstacles and align with the client's goals and readiness for change. This iterative process of exploration, collaboration, and adaptation is key to effective and ethical health coaching. Question 19. The analysis reveals that a client expresses a strong desire to increase their physical activity, but consistently struggles to initiate and maintain a regular exercise routine, citing a lack of time due to work and family commitments, and feeling overwhelmed by the perceived effort required. The health coach is considering how to best apply principles of social cognitive theory to support this client. Which of the following approaches most effectively leverages social cognitive theory to address this implementation challenge? Option A. Advise the client that they simply need to prioritize their health more and find the time, suggesting they should push through their feelings of being overwhelmed by sheer willpower. Option B. Collaboratively explore the client's current daily schedule to identify small, manageable pockets of time for physical activity, brainstorm creative ways to integrate movement into existing routines, and identify existing social support systems that can encourage adherence. Option C. Provide the client with a comprehensive, pre-designed exercise program that outlines specific workout durations, intensities, and frequencies, emphasizing the importance of strict adherence for optimal results. Option D. Determine the most effective exercise regimen for the client based on general health guidelines and instruct them to follow it, explaining that as the expert, the coach knows what is best for their long-term health. The correct answer is B. Collaboratively explore the client's current daily schedule to identify small, manageable pockets of time for physical activity, brainstorm creative ways to integrate movement into existing routines, and identify existing social support systems that can encourage adherence. Explanation. This scenario presents a common implementation challenge for health coaches, translating theoretical principles into practical, client-centered interventions. The core difficulty lies in adapting social cognitive theory, SCT concepts, such as self-efficacy and reciprocal determinism, to a client's unique circumstances, beliefs, and environmental factors. A health coach must navigate the ethical imperative to empower clients while respecting their autonomy and avoiding prescriptive approaches that could undermine their confidence or create dependency. The regulatory framework for certified health coaches, CHC, emphasizes client-centered care, evidence-based practices, and maintaining professional boundaries. The correct approach represents best professional practice because it directly addresses the client's perceived barriers to behavior change through collaborative exploration, aligning with SCT's emphasis on personal agency and environmental influences. By focusing on identifying specific, manageable steps and leveraging the client's existing strengths and support systems, the coach fosters self-efficacy. This method respects the client's autonomy and promotes sustainable change, which is a cornerstone of ethical health coaching practice and aligns with the CHC's mandate to support clients in achieving their health goals. An incorrect approach that focuses solely on providing a detailed, pre-designed plan without client input fails to acknowledge the client's role in reciprocal determinism. This can lead to a lack of buy-in and reduced self-efficacy, as the plan may not be realistic or relevant to their lived experience. Ethically, this approach can be seen as paternalistic, undermining the client's capacity for self-management. Another incorrect approach that involves solely encouraging the client to just try harder neglects the crucial role of environmental factors and cognitive processes emphasized in SCT. This simplistic advice can be demotivating and may not address underlying barriers, potentially leading to feelings of failure and decreased self-efficacy. It also fails to leverage the coach's expertise in identifying and strategizing around these barriers. A third incorrect approach that involves the coach making decisions for the client about what changes are best disregards the client's personal values and goals, a fundamental ethical principle in health coaching. This approach bypasses the client's self-efficacy development and can lead to resentment or non-adherence, as the changes are not internally motivated. The professional decision-making process for similar situations involves a continuous cycle of assessment, intervention, and evaluation, grounded in ethical principles and theoretical frameworks. A health coach should first collaboratively assess the client's current situation, including their beliefs, perceived barriers, and environmental supports. Interventions should then be co-created with the client, drawing on relevant theories like SCT to build self-efficacy and address reciprocal determinism. Finally, the coach and client should regularly evaluate the effectiveness of the interventions and adjust the plan as needed, always prioritizing the client's autonomy and empowerment. Question 20. Strategic planning requires a certified health coach to consider a client's cultural background when developing a personalized wellness plan. If a client from a specific cultural group expresses traditional beliefs about certain foods being inherently healing or harmful that differ from mainstream nutritional science, what is the most culturally competent and ethically sound approach for the coach to take? Option A. Acknowledge the client's beliefs, but consider them secondary to the primary goal of adhering to universally accepted dietary guidelines, prioritizing the latter in the coaching plan. Option B. Assume that all individuals from this client's cultural group share the same dietary practices and health beliefs, and therefore, tailor the health plan based on these generalized assumptions without further individual inquiry. Option C. Engage in a collaborative dialogue to understand the client's specific beliefs about these foods, explore the underlying cultural significance, and then work together to integrate these beliefs into a health plan that also incorporates evidence-based nutritional principles, finding common ground or respectful modifications. Option D. Gently inform the client that their traditional beliefs about food are not supported by scientific evidence, and that they should focus solely on scientifically validated dietary recommendations for optimal health. The correct answer is C. Engage in a collaborative dialogue to understand the client's specific beliefs about these foods, explore the underlying cultural significance, and then work together to integrate these beliefs into a health plan that also incorporates evidence-based nutritional principles, finding common ground or respectful modifications. Explanation. This scenario is professionally challenging because it requires a health coach to navigate the complexities of cultural differences in health beliefs and practices without resorting to stereotypes or making assumptions. The coach must balance the client's cultural background with evidence-based health recommendations in a way that is respectful, empowering, and effective. Careful judgment is required to ensure that interventions are culturally sensitive and do not inadvertently alienate or offend the client, which could hinder progress and damage the therapeutic relationship. The correct approach represents best professional practice because it prioritizes client-centered care and cultural humility. By actively seeking to understand the client's specific cultural context, beliefs, and values related to health and well-being, the coach demonstrates respect and builds trust. This approach aligns with ethical guidelines for health coaching, which emphasize the importance of cultural competence and non-discrimination. It allows for the co-creation of a health plan that is not only evidence-based, but also culturally relevant and sustainable for the client, thereby maximizing the likelihood of positive health outcomes. This is consistent with the principles of patient-centered care and the ethical imperative to provide services that are sensitive to the diverse backgrounds of individuals. An incorrect approach that involves making broad generalizations about the client's cultural group's dietary habits without direct inquiry is ethically flawed. This can lead to inaccurate assumptions and the imposition of a plan that is not suitable or acceptable to the client, potentially causing distress or resistance. It fails to acknowledge the individuality within any cultural group and can be perceived as stereotyping, which is a violation of ethical practice and can undermine the client's autonomy and self-efficacy. Another incorrect approach, which is to dismiss the client's stated cultural beliefs about food as irrelevant to their health goals, is also ethically problematic. This demonstrates a lack of cultural competence and disrespect for the client's worldview. It can alienate the client and create a barrier to effective coaching, as it invalidates their lived experience and cultural identity. Ethical coaching requires acknowledging and integrating a client's beliefs, even if they differ from conventional health advice, to find common ground and build a collaborative plan. A third incorrect approach, which is to assume that all individuals from a particular cultural background will have the same health concerns and require identical interventions, is a direct violation of the principle of individualization in care. This approach relies on stereotypes rather than on understanding the unique needs and circumstances of the individual client. It fails to recognize the diversity within cultural groups and can lead to ineffective or even harmful recommendations, as it overlooks the client's personal history, preferences, and specific health status. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases, followed by active listening and open-ended questioning to understand the client's cultural perspective. This involves seeking to learn about the client's beliefs, values, and practices related to health, rather than assuming knowledge. The next step is to integrate this understanding into the coaching process, collaboratively developing goals and strategies that are both evidence-based and culturally congruent. Finally, ongoing reflection and feedback from the client are crucial to ensure the plan remains relevant and effective.